Greetings everyone. I am Dr. Vikram Paude. I am Senior Orthopedic Consultant at Apollo Hospital, Navi Mumbai. I am glad to able to speak to you on this World Arthritis Day. I am a revision hip and knee surgeon and a sports surgeon as well. And I have been working at Queen Elizabeth Hospital in Scotland for 20 years before taking up this position. First of all, the question which arises in our mind is what is arthritis and why it happens? Is it preventable and is it curable? So let's start with this specimen. This is a normal hip joint. This is a cartilage. This is just like an enamel of the tooth. But as the time goes by, this cartilage gets eroded just like a car tire burning out. And you can see now, especially in this, it has completely eroded just like a tooth enamel which has broken and becomes very painful. When that is the case, we would recommend a joint replacement option. Like this is a hip joint replacement option. Question is, what are the treatment modalities? First, as they say, prevention is better than cure. So do regular exercise when you are young and even if you are a senior citizen, that will help maintain your bone density. Take calcium and vitamin D supplements. Keep your weight under control. Many times arthritis is not only because of obesity. It could be a variety of reasons like gout, post-traumatic arthritis, you have got injury by a road traffic accident and after 10 years you have developed arthritis. Equally, I would advise young people not to neglect their sports injuries, especially the locking of the knee giving way. That could be the signs of your meniscus injury or ACL. ACL is a footballer's ligament which manifests as knee giving way, and locking of the knee is a meniscus or the cushion inside the knee which is broken. If left attended, they can also lead to other problems and arthritis. So after conservative treatment, we can use steroids, some multiple injection like platelet-rich plasma and stem cell. If you are young, we can give osteotomy or knee preserving surgeries or joint preserving surgeries, half of the knee joint, and lastly, a total knee joint replacement surgery when indicated. What are the indications for this? Your activities of daily life get affected. You can't walk for 10 minutes. And while turning in the bed at night, your night sleep is disturbed because of the pain. That will be the real indication for a joint replacement. But remember, prevention is better than cure. Maintain a healthy lifestyle. Keep your weight under control. Get checked for your metabolic diseases. And at some point of time, pain is inevitable, but initially manage with analgesics, local steroids, and keep the best for the last. I hope this advice of the World Arthritis Day will help you modulate your lifestyle and make better life choices and will help delay your arthritis and help you make a better life and get your activities of daily life. I wish you all the best. Thank you so much.